Hey, hi guys, wherever you are in the world, thank you for joining me on this really interesting, exciting video this morning. I hope you're having a great week. I certainly am. What I want to talk about today is frontal temporal lobe dementia that is actually affecting a couple of well-known celebrities. The two people I'm thinking about here are the amazing, well-known, famous Hollywood actor Bruce Willis and a lady called Wendy Williams, who was, up until last year, a TV presenter, a very well-known TV presenter. So let's talk a little bit about the disease, the dementia itself, how it impacts on people, and why we should be focusing on when a celebrity is actually diagnosed with a form of dementia. So frontal temporal lobe dementia is one of the rarer types of dementia that usually affects people younger. Usually onset is usually between the ages of 45 and 65. So they're a little bit younger than what we would expect to see Alzheimer's disease, for example. A big difference between something like frontal temporal lobe dementia and Alzheimer's disease is the way in which it impacts on the person. So frontal temporal lobe dementia, as it gives you in the name, affects the frontal lobe of the brain and the temporal lobe of the brain too. And these are areas that are responsible for things like personality, behavior, speech and language. And so because of that, those are the three areas that are mainly impacted by it. There's also sometimes an issue with mobility. So let's talk about the personality changes. The personality changes become pretty obvious. People change. They might become agitated, frustrated, aggressive, physically or verbally. So their actual demeanor changes. And that's because the part of the brain that is impacted by this protein is causing that issue, that problem. The thing about communication, speech and language, there's a part of the brain called the Wernicke's area and another part very close by called the Broca's area. And the Wernicke's and the Broca's are responsible for speech and language. So very often with frontotemporal lobe dementia, one has aphasia, which means difficulty speaking, finding the words. It's also often referred to as dysphasia, but there is a little bit of a difference between the two, because dysphasia is a milder form of maybe not being able to understand what somebody is saying, receptive dysphasia, or not being able to find the words, construct the sentences, which is expressive dysphasia. Aphasia is a more severe form of dysphasia. So that comes along with it as well. The mobility aspect, sometimes people have difficulty walking, so that's impactful as well. It doesn't always immediately impact memory, so memory might not be impacted until a little later on. But because of the other things that are impacted by it, then it does affect lifestyle. It affects people's work. So if you think about both Bruce Willis and Wendy Williams, Bruce Willis, Wendy Williams, they sound similar. If we think about them and how it's impacted on their work, Bruce can't act anymore, he can't work, and she retired last year, she stopped working. Little bit of a difference here in that Wendy Williams had a lot of severe health issues over the years. You know, she was a drug addict, so she had that treated, she had that to deal with for many years. And it kind of led to a lot of ill health issues like She was diagnosed with Graves' disease. She was diagnosed with hypothyroidism and many other edema and a whole bunch of other ill health issues. And a lot of court proceedings and guardianship orders and Wells Fargo freezing her accounts until she got a guardianship and things like that was all unfolded within her story. Pretty sad, tragic, until she eventually was diagnosed with frontal temporal dementia. So why is it that we should think about celebrities when they have this diagnosis as opposed to somebody who is not a celebrity or a well-known person? I think the thing is, it attracts attention and it brings awareness of the disease, and therefore it gets people interested and they start reading about it and learning about it. Because, you know, if you're a massive fan of Bruce Willis, like Lynn, she apparently is a massive fan of Bruce Willis, so she would, and Lynn is a researcher, she loves to research stuff, so she will have researched what was impacting on him and how it impacted on his life and his work, and the spouse and the family and friends. As we always say, you know, it's a journey. When you're going through cognitive change, when you're going through memory loss, it's a journey, and we're all on it. Everybody involved in that person's life is on that journey. And I guess it's quite appropriate that I very often refer to journeys as movies or stories, where the person who is living with cognitive change is the person that is the star of the movie, the hero of the story, which I guess is quite appropriate for Bruce Willis. So everybody around are all co-stars and supporting that cast. They're the supporting cast supporting that star. So that's the reason why I think we should take note when celebrities are diagnosed with any kind of neurocognitive or neurological disorder. Michael J. Fox, who has Parkinson's disease and has had Parkinson's disease for many, many years, is a massive advocate for Parkinson's. He's raised a lot of awareness about it, and I kind of have a lot of respect for him because excuse me, I'm distracted by something. I have a lot of respect for him because of his disease and because of the way that he's living with it and he's coping with it, and he's not letting it destroy his life. He's still attending functions, he's still advocating, and he's still like on it as far as the disease is concerned. So I have a lot of respect for him for that. So it does raise all that awareness and educates people. And as you know, this is why I do this channel. This is why I do these videos. Education, education, education. So just going back to the frontotemporal dementia, there is a behavioural form of it as well. And when somebody has that behavioural variant, that becomes more difficult to support somebody. There are many more challenges in terms of behaviour, in terms of no insight, in terms of inhibitions being erased, in terms of not being able to function without a great deal of support and a great deal of understanding for that behaviour. So it's very challenging for families to deal with that, and especially when somebody becomes aggressive and abusive. Very, very difficult when that's happening each and every day. So that's the disease. That's how it impacts on Bruce Willis and Wendy Williams. And they're celebrities who are still alive and they're still living with it and being supported through it. And there are many, many other celebrities that have experienced neurocognitive, neurological disorders who are no longer with us. But again, I think today in 2024, the awareness is an amazing thing. So always look out for celebrities. When a celebrity is diagnosed with a neurological or a neurocognitive disorder, look at it, look into it, listen to it, read the stories. Ignore the sensationalism around it, because that's what the media do. They sensationalize everything. But if somebody's saying that they have Alzheimer's disease, research it, look at it, and educate yourself. And the same message goes out there to families, to friends, and to everybody in society. My message and my request to you guys is, please research dementia. Please understand the basics of it and how it impacts on people, so that you learn and understand there's nothing to be afraid of. You learn and understand what you can do to help and support. And that's what it's all about. So, unless Lynn has any questions about that.
Well, you often say that people usually have more than one type of dementia.
Right.
So,
yeah.
Is that true with frontal temporal dementia?
It's very, very unusual to have one form of dementia. It does happen, it can happen, but it's very unusual. More often than not, and we refer to this as mixed dementia. So more often than not, there would be another supporting dementia along with it. So yes, it's quite possible that Bruce Willis and Wendy Williams may have another form of dementia going along with the frontal lobe type dementia. Yes.
So which dementia does the neurologist or dementia specialist focus on? Or is it about, it's not about what the diagnosis is, more as managing and living well with the symptoms and behaviors and personality changes?
Absolutely.
You don't have to label it necessarily.
No.
To understand.
That's right. And this is why we now diagnose somebody with a neurocognitive disorder of the Alzheimer's type, for example. So we will say severe neurocognitive disorder or mild neurocognitive disorder without having to label it, because in the past it was dementia. And that, as we all know, is a meaningless term. So the DSM-5 now has the terms neurocognitive disorder. Yeah. And sometimes, or maybe most often than not, there will be one of the dementias that surfaces as the primary cause. And very often that's Alzheimer's disease, because that's the most common type of dementia that people have. So you would treat for the Alzheimer's disease if the MRI shows that there are the neuritic plaques and tangles, the beta amyloid plaque, the beta amyloid protein is in the brain, then you would treat for Alzheimer's disease. And with Lewy body type dementia, for example, one of the medicines we use for Alzheimer's disease, Aricept or donepezil, is a very good drug for Lewy body dementia. People with Lewy body dementia respond very well to that medicine too. I hope that answers that question.
Yep. I'd like to point out too, if you have the time and are interested, if you do a search online for famous people with a form of dementia, you'll be really surprised at the people's names that you will see, and people, not just actors and actresses, but singers and politicians and all types of people. So that'd be eye-opening to do that. So I encourage people, if they're interested, to see that. Also, I think my comment about, which one do you treat, what symptoms are you treating, but it's really about living well. It all circles back to living well. It doesn't matter what you're diagnosed with. It doesn't matter, if they can label it or not, or if they're not sure, but if you're managing and treating the symptoms and the personality issues and sleep issues and everything that comes along with this, because there's probably other things going on in your body that just may not have been identified yet.
Right. Yeah. And that's a good point, Lynn, because it is about living well with whatever it is you're living with. It's about living well with, not suffering from, but living well with. And we try and encourage people not to use that that terminology. It's very negative. We try and encourage people to use positive terminology, living well with, because if I tell you are suffering from, you're going to suffer. If I tell you you can live really well with this by doing this, 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 and this, then you will go in that direction. And whilst it's important to treat the symptoms and any behavioural issues, any anxiety, agitation, frustration, depression, all those things need to be addressed, need to be treated. It all helps to live well with the condition, the disease.
Right, and highlighting Bruce Willis and Wendy Williams brings attention to the disease and brings attention to people who maybe never even heard of frontotemporal dementia. But what I want to say about this is that just because they're celebrities doesn't mean that if you take their life and take somebody else who's not wealthy and well-known and rich and famous, both categories of people are still able to live well with dementia. It's not about how much money you have or access to certain things. There's things everyone can do regardless of their station in life.
Right, yeah. As we know, it doesn't discriminate. So, you know, it's like every other disease and illness. There's no discrimination between it. We've got a couple of royals, members of the royal family, dealing with cancer at the moment. You know, so nobody's immune to these things. Everybody's on an equal footing, and especially when they see their neurologist or their clinical dementia specialist, everybody's treated exactly the same. You know, nobody is treated better than anyone else. Absolutely. Yeah.
But they can all, regardless of how much money you have or how wealthy you are, you can still live well with dementia.
Absolutely, and that's a mindset to adopt, isn't it? Because I have patients who do live well with their challenges, and they have support from their family to help them live well with their challenges. And I have other patients who are really struggling with that. They're really finding it difficult to adopt a mindset of positivity. But that's the main thing we need to do. You know, we have to try and encourage people to maintain a mindset of positivity, and it's all about compensating for any losses. There are going to be losses. It's a neurodegenerative disease. There will be losses, but because we've gone through life with many tools, we can find ways to compensate for those losses. Yeah, so driving is a big one. You know, when people can't drive any longer, that impacts massively on most people. As I've said 100 times on here, it wouldn't bother me. You know, I don't care for driving. I drive because I have to. So it wouldn't have such an impact on me. Other people, it does. So we have to look at, okay, you can't drive now, so how can we compensate for that? And so we look at other avenues, other ways of transport, other modes of transport to maintain people's independence. I can't go to the grocery store anymore because you've taken my driver's license off me. Well, you can, because there are transport, there's a bunch of transport services available that will get you there and bring you back. So there's always ways of being able to compensate for losses, and that's how we end up living well with whatever it is we're living with.
So the bottom line is attitude is everything.
Attitude and mindset is absolutely everything, yeah. And it's been demonstrated many times, you know, if you have a positive mindset about things, it doesn't impact you as much as it would if you had a negative mindset. The disease can slow down much more. So that's it. That's me done with this topic today. Thanks for tuning in. Thanks for listening. Please share this video with all your family, friends, colleagues, collaborators, supporters, followers, everybody in your world. Share this channel, get them to subscribe, because the more people we educate, the better it is for worldwide in general. So thanks for that. Follow me on Facebook, follow me on Instagram, look at my website. Any questions, any messages, just send it through this channel or Facebook or Instagram and we will respond. Thank you. Have a fantastic week. And just before you go, I want you to remember and to say it with me, dump the soda.